Hi, I'm Flavia.
Hi, I'm Sobra, and
Welcome to
Gyna
Gynageeks Kenya.
So you delivered, you had a cesarean section, and the question on your mind is, am I going to deliver vaginally again, Daktari? And today, that is a topic we're going to talk about. So, Flavia, tell us about Vbac.
So Vbac is vaginal birth after cesarean delivery, or TOLAC, which is trial of labor after cesarean section, just as the name suggests. So who qualifies? Who would come to the clinic and we tell them that, okay, you can attempt to have a vaginal birth after cesarean section?
I would say the woman who has only had one cesarean section done. The minute you've had two or more done, you're no longer eligible for a vaginal birth after cesarean.
Okay. Another one would be that maybe your first pregnancy you had a normal birth, then you had a cesarean for another reason. So if it's a third time, you have a chance to have a normal birth after cesarean section.
Also, if the reasons that cause the cesarean section to happen in the first place are no longer recurring in this current pregnancy. For example, if your pelvis was not adequate, chances of your pelvis being adequate now are almost zero.
So you would not attempt.
You'd not attempt a
As opposed to
Vbac.
someone who had a breech presentation, which means the baby was seated, and the next pregnancy, the baby is okay, then you would attempt. Another factor would be maybe the weight of the baby. So if you have a big baby, like a baby heading towards 4 kilos, your chances of a successful birth are much lower than if the baby was small, 3 kg baby.
And less, okay. And maybe just to cap it off is a Vbac should only be attempted in a hospital setup where close monitoring can be done, and there is also a ready theater, just in case you may need an emergency cesarean, that it can be assessed quite fast.
Okay. So what would be the benefit of having had a successful vaginal birth after cesarean section?
What that means is we simply put you back in the normal delivery pool. As long as you still fit the criteria, every pregnancy moving forward, we shall attempt a Vbac.
As long as you fit the criteria.
Exactly.
But what would be the risk? Because it's also a big risk.
The risks are immense, and maybe the risks here should be divided into two. What are the risks to the baby and what are the risks to the mother?
So to the baby,
we are risking fetal distress, and you know what, say it as it is, also fetal death. To the mother, maybe...
The mother would be that you could rupture your uterus. Your uterus could give way and rupture. Risk of bleeding, risk of losing your uterus as well. And also risk of death, especially if it hasn't been picked up early enough. And that's why you need to be in a setting where you have close monitoring and you can go into theater early to try and save either the mother or the baby.
Perfect.
So vaginal birth after cesarean section is possible, but you do need to meet the criteria. So that's something you have a discussion with your gynecologist, the obstetrician while you're in clinic, so to create a birth plan.
Create a birth plan, yes. And then also maybe better prepare you, because even as you make choices as a woman, those choices you should understand that they carry risks, and if you're willing to take up the risks, then that's perfectly fine.
You can go ahead.
Exactly.